Glioblastoma is one word that causes a lot of fright in the medical field. Glioblastoma describes the most aggressive and sadly the most common type of brain cancer. Currently, there is no cure for it. As this form of tumor contains many different types of cancerous cells, no treatment can effectively target them all. Meet the team of Romanian researchers who are working on developing new ways of radio-sensitization. Highly efficient radiation is aimed at inhibiting DNA repair in cancer cells. The novelty of this new radiotherapy consists of irradiation with protons and carbon ions compared to conventional X-rays. Revealing molecular mechanisms might help identify biomarker signatures. This may support the development of personalized treatment of glioma patients. Find out how Romanian and Norwegian scientists are pioneering the field of radiobiology.
Could you please provide details about specific aspects of your project?
As the title of the project suggests very well, this project aims to develop novel approaches for treating glioblastoma. Glioblastoma is the most aggressive brain tumor with around 87 patients that succumb within 2 years of diagnosis. Practically, we can say that there is at this very moment no cure, being a very extremely radio-sensitive and chemosensitive tumor. Probably everybody knows that radiation can kill tumor by damaging the DNA in the nucleus, and these macromolecules, if it is not repaired, produce cell death. Conventional radiation therapy, it is highly used as an important part in the treatment of glioblastoma, but in some cases the tumor cell may survive due to the high capacity of these tumor cells to repair the radiation damage, including the DNA damage. So, one promising strategy that could be applied to improve the treatment could be to combine the radiotherapy with DNA repair inhibitors. Furthermore, radiotherapy with protons and carbon ions are emerging as promising alternatives to conventional radiotherapy, potentially giving more efficient tumor cell kill and less side effects to surrounding healthy tissue. Therefore, we can aim to identify drugs inhibiting DNA repair to radiosensitize glioblastoma exposed to different types of radiation. We will expose a cell to high LET particles and also to conventional therapy, which is low LET irradiation. And this we will do to compare the effects of these different types of irradiation, especially because the effects produced by the combination of drugs with particle therapy is less known, usually. We also aim to understand the underlying mechanisms that control radioresistance. If we will manage to fulfill these targets, we will lead to an optimized in vitro preclinical model. And besides this, we will be able to decipher the mechanisms of DNA damage signaling after combined treatment. And also, hopefully, we will be able to identify biomarkers of radiosensitization after fulfilling this study.
What are the anticipated benefits or potential advantages of utilizing high LET radiation in combination with drugs for glioblastoma treatment?
The advantage of this combination is coming from the physical characteristic of this type of irradiation, because in this specific irradiation, the higher dose is deposited directly in the tumor, sparing, in this case, the normal healthy tissue that surrounded the tumor by comparison with X-ray, for instance. And in this case, we will have more DNA damage, more complex DNA damage, more difficult to be repaired, and also we will have better specificity and lower toxicity, and if we will combine with the drug, we hope that the efficacy of the treatment will be better.
What are the partial findings of your research so far?
So we can say that we have some partial findings. One of these findings is very important because we validated 2 drugs which radiosensitize glioblastoma cells to all the types of irradiation that we used. So, I mean X-ray, protons, and ion carbon irradiation. In addition, we discover also several mechanisms related to the DNA damage response signaling that may control the radioresistance. And also we obtain some data related to the influence of tumoral microenvironment on glioblastoma cells by using co-culture models. And what it is very important, we obtained a list of new candidate drugs that could be validated and used in the future projects.
What are the next steps in your research?
The next step is first to integrate the data that we collected until now and to formulate the in vitro preclinical model. And then, of course, after we will finish this project, we can validate this model by using some other cells, different than we use here, more complex models. And then also we can translate this preclinical model to in vivo preclinical model, and this will be possible because our partners from Norway have already this model prepared. Not only that they have this mouse model, but they have a condition to irradiate the animals, which is a problem usually. You can irradiate a cell, but it's not necessary to be able to irradiate animals because we are speaking about a different setup for this. And of course, after we will do this in vitro preclinical model, after this model will be validated, we can translate this to the clinic. And then, of course, to the pharmaceutical market.
Speaking of the Norwegian partnership, are there any other advantages for the project and for your team?
Of course, there are a lot of advantages because we improve our expertise. We are improving and we will improve our expertise in DNA damaging signaling because they are expert in this field. And also they have expertise in performing the screening for identifying the drugs, which is a very complicated technology. And they are very eager to continue our collaboration. So it will be a long-standing collaboration, hopefully. And I want to mention here that our young researchers benefit a lot from this because they already went in their laboratories and they came back to implement some new methods and of course to learn the philosophy of this type of research. And of course we want to apply for new projects. We already discussed about this, and when we will have the opportunity, we will do it. Because together with them and with the other 2 partners that we have from France and England, we are already nucleus, let's say, and maybe it's easier to accede to this project, to apply projects in international collaboration.
What is the social impact of your project?
I think it's too early to speak about this because this is a study for a long run, and on a long term, I think after we will reach to the clinical stage, then we can offer new protocols for treatment of glioblastoma. So this will be important for this and for improving the quality of life of the patients.
And in conclusion, for the people that watch this interview, What would you like them to remember about your project?
I would like the people to be aware that in our institute was built by involving international teams, a network of capabilities and capacities to do high quality research for finding new strategies to fight against cancer. This is my message for the people that are watching this.
Thank you for watching Research in the Spotlight, a podcast for scientists and passionate science people made under the Norway Grants Research Program by the Executive Agency for Higher Education, Research, Development and Innovation Funding as program operator. Until the next time, like and share this episode if you think science is a key to a better future.